the research has been done and we have the guidelines and we are following them. So we are keen to protect ourselves and protect you as well. So make sure you have actually had your dental checkup. Hello guys, Dr. Kendi here and welcome back to My Oral Health Diaries. On this week's episode, we are going to be discussing if it is safe to visit a dental clinic. We have been encouraging us to go for dental checkups, and I'm sure most of you are wondering, is it really safe to go for a dental checkup or to do a dental visit while there's still COVID around? So I'm just going to be discussing, what the precautionary measures and the protective protocols that have been put in place in the dental clinic to ensure that we are protecting ourselves and protecting you from COVID-19. So before we discuss what we have put in place in the clinic or what has been recommended by CDC and WHO, we're just going to discuss what COVID-19 actually is. Maybe in due time we can get an expert to come and give us, more in-depth information, but I'm going to try my best and simplify it just so that we have a basic understanding of COVID-19. So COVID-19 is essentially an upper respiratory tract illness. So it is an illness that affects the upper part of the respiratory tract. So this is kind of like the trachea going up, nasopharynx, oropharynx, those areas, kutoka kwa mdomo, mapua, kwenda chini. And then when it gets very severe, it now goes and affects the lungs. So COVID-19 is transmitted via droplets. It's not like TB. There was this theory earlier that COVID-19 is airborne. Not really. It kind of has to be carried in like a substance for it to move around, not like TB where it just spreads through the air. What is really special about the dental clinic setup is that during our procedures, we generate a lot of aerosols. Aerosols are just these tiny droplets that are produced during working. So with COVID-19, then these droplets become infectious. Okay. So COVID-19, we've said, is a virus that essentially causes an upper respiratory tract illness. So when it infects you, it causes the kind of like the modulators of effective, blood pressure and inflammation to be altered with. So then you become sick because you are unable to breathe properly. It kind of causes, it's a type of pneumonia, really. So your lungs are kind of congested. So that's why most of the times you hear when people have severe disease or severe COVID-19, then they have to go for admission in HDU because their oxygen levels are low. That's just because the virus has now moved from the upper respiratory tract and it has infected the kind of the alveoli where there's gaseous exchange happening in the lungs. So the patient is now unable to breathe properly. They don't have enough oxygen saturation in their bodies. So we do understand as oral health care providers the risk that we are at, like with COVID-19. But the good thing is that over time, research has been done and recommendations have been put forward on how to protect ourselves and how to protect our patients. So as you can see today, I have just put on a gown. So this is kind of like the recommended wear for now during these times of COVID-19. Why is this gown special in the dental clinic? It's normally, the material does not allow the droplets to go through. So unlike the normal textiles that allow free movement of fluid, between your body and the patient, then this kind of protects us so that if there's any aerosol being generated, then there's no seepage of material into your clothes or onto yourself. So there's that. So we've gone into PPE or personal protective equipment that is protecting us from, it's like a barrier from COVID-19. So we have this gown that is definitely recommended. We also need to kind of like cover your head. So we have a surgical cap that we have also been recommended to wear. In dentistry also, we have been advised to use a respirator. A respirator is just kind of like a special mask that protects the wearer. So I'm just going to remove this. This is just an N95. I'm sure most of us have seen it or are using it, but this is special because it has a respirator. So it protects us to make sure that we are not breathing in the aerosols. So your oral healthcare provider will probably have this on, and then on top of this, a surgical mask. So this is just the kawaida mask that we use, but when we are doing procedures here in the dental clinic, then we protect ourselves and you by wearing the respirator and the surgical mask as well. In addition, we also have this. This is a face shield. So it's kind of like a barrier. So whenever there is splatter, it doesn't come into direct contact. Why is that important? With COVID, it can essentially just spread through the mucosal lining. So if there's any splatter into our eyes or like our nose, anywhere where there's like contact with the respiratory tract, because from the eyes it can move from the tract that connects the eye to the nose, and then from the nose to the mouth, and then to the respiratory tract. It's a whole complex thing, but this kind of just protects us from the splatter. So we've discussed that, you know, it is safe. There are PPEs, there's very clear guidelines on how to use them. When you come in and see your dentist in this, sometimes you look really overdressed, but it's for your own safety. There's a patient who told me they wouldn't know me when they see me out there, but it's for your own good that we're actually putting on the PPE. In addition to the PPE that we have just discussed, the recommended guideline is that every patient has a room on their own. It's not like Kitambo where there was like a whole like hall and patients were being seen together. With COVID now, because of that aerosol, then we have to separate the rooms. So you're either in a different room, or if you're in similar rooms, then there's a barrier that is put from the floor to the ceiling, and this barrier should be cleansable. All right, another thing that's been recommended is that when you come in, you will notice for some clinics we have put in air filters that, you know, we run after each patient so that they can kind of clean out the air. If there is a window in the clinic, you may notice that the unit, like your head will be facing towards the window, just to make sure there is clean air circulating around. Another thing, when you come to the dental clinic now because of COVID, you may have to wait a bit between patients. So if you notice that the person ahead of you has come out, don't be in a hurry to come in, because then we have to disinfect the area as per the guidelines. We have to kind of swab everything down to make sure that there's nothing, like there's anywhere there's splatter, we make sure we disinfect it and make sure it's clean so that there's no viral deposits that are left there, just for your own safety. Recommended guideline is like 15 minutes between patients so that even the air can kind of just like circulate, it's fresh air coming in. We definitely understand the concern that you have visiting a dental clinic in this COVID times, but we would like to reassure you that, you know, the research has been done and we have the guidelines and we are following them. So we are keen to protect ourselves and protect you as well. So make sure you have actually had your dental checkup, and when you have a dental issue, don't be scared, because I know there are so many people who kind of like fell off the wagon that time when we didn't know what exactly to do. So be rest assured, we now know what to do. Whatever has been put there, just follow whatever you're being advised to do and you'll be good to go. Thank you so much for joining us on this week's episode. Keep subscribing, keep sharing, and let's continue learning more about oral health. See you next week. Special thanks to Villa Dental Care for allowing us to use their space for this demonstration. We really appreciate them. It's an awesome place. Let's do this. We're ready? You'll tell me when we're starting. Oh, you started? Hey, Craig. On this week's episode, we are going to be discussing, you know, how... Sorry. Sijui topic ata. As in sijui kuiframe. On this... Okay. I'ma kill my vibes. Vibe killer.